The story that really made me take a look at this, though, is the story of a guy named Chris who was here at the first meeting that I did, and that I came to, and he had a couple different problems. First one was that he was in the Gulf War, and he had Gulf War syndrome, and part of his problem is he had sand that had been blasted into his eyes from the sandstorms over there that had bacteria and pollution, all sorts of stuff in it, and he had developed a chronic weeping sore across the front of his face. It was in other areas of his body as well, but this one was the worst. And he was a business coach where he did a lot of public speaking and one-on-one consultations, and to have a weeping sore across the front of your face, it's kind of a challenge, okay? His dad is an internal medicine doctor. He'd received the best medical care. He's been on everything. He told me that he'd even been on the antibiotic for MRSA. That was the only one that got this sore to go away. It went away for a week. As soon as he got off the antibiotic, it came right back. He'd been to plastic surgeons saying, can you just remove it and just put a skin graft over it? The plastic surgeon said the problem is coming from underneath the skin. If we put a skin graft on there, it's just going to slough off. So it's not going to do you any good. So he's been living with this for years, decades. The second thing that happened to him was in 2006. He has some horses. Mare had a colt. He went in to give the mare some medication to give it a shot, and the horse felt threatened, and the horse attacked him, kicked him. He ended up with a crushed skull, lots of broken bones, but he ended up with a brain injury that left him with a cognitive deficit, to where when he talked slower. When he was talking to people, he'd have to say, can you back up? I didn't quite get all that. He'd repeat himself and different things like that. Well, this was a big blow to his, to his profession, because you're a business coach, and that made the whole thing difficult. And it kind of made the public speaking part of it had to go away. Anyways, so what happened was December 2010, he heard about this, and Denny told him, I want you to drink it, and I want you to start spraying it on your face. And he said that, you know what, I've been through so many treatments with this thing. He goes, I sprayed this stuff on my face, and he goes, that night, in one day, that night, it started to form granulation tissue. Where it was weeping before, it started to form like a little scab on there. And he goes, wow, something powerful was going on here. Well, long story short, in a matter of a couple of weeks, that entire sore went away, and it has never come, well, it's never come back, and this is June the 9th, 2011. 6 months later, it's still gone, okay? Now, here's the thing, though, that really said this is a game changer, this is different. He started taking that stuff, drinking it as well, and in a month and a half, his cognitive deficit disappeared. He talks as fluently and plainly as anyone else in this room does. And he doesn't have to go back and say, wait a minute, what just happened? Now, the thing that's significant about that is you can talk to any neurologist, and when you have an injury like that, you will progress. About 90% of the progress you're going to make will take place in the first year. The second year, you may be able to get another 10%. After 2 years, the whole neurologic science community agrees that after 2 years, that's as good as it's going to get. We're not really going to get much better than that. So this happened in 2006. He started taking it in December 2010, which is 4 years later, and all of a sudden now he's improved. To me, that was a game changer. Something was different. That's what really told me that I've got to take a look at this. I know there are people that are suffering because they don't know about this technology. Now, we could talk about stories all we want, and everybody loves to hear about known health concerns. Someone had this massive challenge, they got on Asea, and it helped them. And that's great. But more importantly is before there's fire, before there's a big symptom or a disease, there's smoke for a long time. The first symptom of a heart attack in 30% of the people with heart disease, the first symptom of heart disease in 30% of the people with heart disease is a heart attack. That's a big first symptom, okay? Cancer, when we're talking about cancer, it brews in the body for usually about 5 to 7 years before it's a palpable lump, things like that. So what I'm getting at, an ounce of prevention is worth literally a pound, maybe a ton today of cure. So it's important that, yeah, if you have a health problem, let's see if we can, this can help it out, help yourself. But more importantly is the preventive side of it, and that's why I'm on it. I want my cells to be regulated and healthy for as long as possible. That's basically, so who do you know that deserves to hear about us?
I was asked to sit on the board of a small company that had been working on a technology for about 15 years. Numerous patents, a lot of research.
He let me know that He was on the board of directors, and there was this opportunity that was coming up on a product that he thought was wonderful.
But I told him, I said, you know, they have something here that they don't know what it is. And it's a lot more than they think.
Well, that was my opportunity. I pulled out my wallet and pulled out a check out of the wallet, and Virtus, whatever you need, we're going to do this.
And he wrote this check out for a very big amount of money, and he said, there's more behind that, let's go put an offer in. And I said, are you serious?
Now, I didn't know anything about the product or the company, but I knew Virtus, and I was betting on Virtus. I knew that Virtus had done his research. I knew that Virtus was not going to lose.
After 2.5 months, we decided to go out and do an assessment of the 40 people that we had given the product to. And when we went out to do an inventory, we found out that the 40 people had turned into 135 people. And not only that, the product had gone to 20 different countries.
And as we gave the product to different people, we found that it really increased their quality of life. People that were seriously challenged. And it just gave us a sense of purpose.
Recently, my son asked me to come down and join he and his family, and we went to a church gathering. And there was something going on he wanted us to be a part of. And while we were there, a young lady came up, and he introduced me to this young lady, and she broke down and started sobbing. And she had a health challenge in her family that was really severe, and she was introduced to Asea. And because of what Asea did, she was just grateful. So I find it hard to talk about, but that's the reason.
Okay, so we just saw there that Virtus Norton said that's the reason, and he was a little emotional there, okay? So we got to back up and talk a little bit about how this company came to be. It started out as a different company, a biotech company, and their goal was to stabilize these signaling molecules so they could sell that technology to a pharmaceutical company. Well, actually, after 15 years and millions of dollars in research, they stabilized them, but they were actually only stable for 10 minutes. They could get them together, and they would just slowly denature over 10 minutes. And so the problem was, it was like, hey, mission accomplished. We went out and reached our goal, but it didn't have any practical application in the real world. So at that point, they were out of money. They were way upside down. They made this amazing discovery that practically it was useless. Okay? Well, Virtus Norton sat on their board of directors. He knew what they'd done, and his job is he's been a strategic planner his whole life. He worked for Fortune 5 companies, taking them from here to here. He says, this is how we're going to do it. So he saw an opportunity here. He said, hey, they've got something here. We just got to do a little bit more to it. It's going to be worth something. So they bought it, got it with James back, and wrote him a check for several $7 million and bought the technology. And what they needed to do next was stabilize it, not for 10 minutes, but for, something that would have some shelf life. So they brought on Gary Samuelson, a PhD medical atomic physicist, and his specialty was in stabilization. And after another year's worth of research, they stabilized it, and that's what we have now in Asea, is stabilized redox signaling molecules outside the body with a shelf life of over a year. So at that point, they celebrated. Their goal was the same thing. Now they want to take this and sell it to a pharmaceutical company. So they did two things at the same time. Number one, they did tests to find out that it's non-toxic. You can drink as much of this as you want. It's less toxic than vitamin C or anything. It's got about the same toxicity as water, okay? So you can drink as much as you want, and the only thing you can do is drown in it, but you couldn't drink too much of it to make it toxic. So they knew it was safe. So they wanted, it tastes a little bit like pool water. They didn't really know if people would even drink it. So they wanted to get a test group of some people with some health challenges, put them on it, and they also wanted to start marketing to pharmaceutical companies and say, hey, is there any interest in this? So they found those 40 people. They said, listen, drink this 2 ounces twice a day. If you want to drink more, that's fine. Drink as much as you want. If you run out, call this number. We're going to send you another case. We're going to check back on you in 90 days and see how you're doing. So then they went out and they started marketing to pharmaceutical companies. A pharmaceutical company came forward and said, we understand what you've done. We understand the science behind redox signaling molecules. We understand the vital role that it plays in cellular health, and we want what you've got. We want to give you an offer right now that will give us exclusivity on what you've got, so you will not, keep marketing and talking to other pharmaceutical companies. We want it. They gave them an offer that was roughly about 20 times the amount that they had paid for it, which was going to give generational wealth to Vertus Norton and James Pack for generation after generation into generation. They would be taken care of forever. Okay. So, hey, it was mission accomplished. That's what they set out to do. They took a company from here, took it to here, and now it's time for the payoff, and wow, exciting. There was one problem. In order to get a drug FDA approved, you've got to have it off the market completely. And they had a test group that was taken it. So the pharmaceutical company says, you've got to go out, gather up all the product, get everybody off it, and so we can take this through the FDA approval process. And so they went out 2.5 months instead of 90 days later and wanted to get the product back. Well, they found that people were really impacted. They were really helped. Specifically, 6 of those 40 people were terminally ill and really only had months to live. 5 of those people are still alive today, several years later. They got the same story from all of them. Basically, it was this: my health has been doing this. I got down to a point here where my doctor told me, you've only got months to live. You gave me this Asea, and I'm starting to do this again. If I get off this, I don't have a chance. So now all of a sudden, you've got these 2 corporate CEO businessmen with a bit of a moral dilemma. They went back to the pharmaceutical company and said, listen, this stuff is non-toxic. Can we just keep it with those 40 people and still make this deal happen? The pharmaceutical company said, I'm sorry, you know what? Some people are going to have to die. That's the industry we play in. When we give someone an experimental drug, it may kill them. When we give someone a placebo, if we would have given them the real drug, it may have saved their life. People die from this research all the time. It's just, it's not that many people. You're going to make millions. We're going to make billions. Do you want to play this game or not? And when they stood back and looked at it, they realized that, the FDA approval process is a whole nother animal. What happens is it takes anywhere from 2 to 8 years to get a drug approved. The cost is averaged between $200 million and $700 million. And basically what would happen is by the time it went through that, a 32 ounce of Asea would cost somewhere between $1,000 and $2,000 and would be available by prescription only. So they decided, you know what, we've got to get this to the public as quickly as possible. It's had this big of an impact on this small of a group. Now, not to mention, it went to 135 people in 20 different countries. So the way this worked is there was no compensation plan telling people, hey, if you get this out there, you're going to make some money on it. This was just plain people taking a product, getting a result, and going, my gosh, I can't believe it. My brother, my cousin, my aunt, my uncle, whoever needs this because they have a health challenge and I know that it can help them too. They got another case and they used their own money to send it to them saying, try this, it's going to help you. So they knew they had something.